Hi everyone, my name is Kiana Francisco. I'm currently an MSW student. I'm going to be presenting a systematic literature review on service dogs, their impact on PTSD symptoms among veterans. A little bit of my outline, general background. I'm going to talk about the research question, methods, results, discussion, and references. So a little bit of background, post-traumatic disorder is a syndrome of prolonged stress reactions that can develop following a traumatic event. In the last 21 years, about 20% of veterans are diagnosed with PTSD each year from Operation Enduring Freedom and Operation Iraqi Freedom. Service dogs are increasingly being used by veterans with combat-sustained injuries to supplement other PTSD treatment approaches for veterans. Service dogs can also be less stigmatizing and more appealing than traditional therapy approaches. This systematic literature review assesses what published research accurately demonstrates how service dogs supplement other PTSD treatment approaches for veterans. So basically my research question is, how do service dogs supplement other PTSD treatment approaches for veterans? We can examine existing publications on perceptions of how these service dogs have assisted with PTSD treatment. And this study seeks to answer the broad research question for that. A little bit of my methods. So the data from the existing peer-reviewed literature provides a more in-depth understanding of service dogs involved in treating veterans diagnosed with PTSD. So the main objective of this study is to investigate the key elements and scope of definitions through what is known in published literature. We achieved this research objective by answering the following specific research questions. How do service dogs reduce PTSD symptoms such as nightmares, triggering events, anxiety, panic disorders, and enhanced medication adherence? What type of barriers arise to animal assisted therapy for specific conditions? And how are human and animal safety participants affected by trials? So this is a little bit of the following search parameters that I used to collect the articles, all done and held by Hawaii Pacific Health University Library, all done through EBSCOhost, and the publication dates range from 2010 to 2022. So the results that were in, the purpose of this study was to examine the existing publications, once again, of perceptions of how the service dogs have assisted with PTSD treatment. A total of 45 articles have been peer reviewed through the HPU Library database. And within that research, out of the 45, 10 met the inclusion criteria and were used for this study. 5 categories related to the use of service dogs for veterans with PTSD using a thematic analysis of the study findings. So the inclusion criteria included veterans of Operation Enduring Freedom and Operation Iraqi Freedom, veterans ranging between the ages of 18 to 73, also was diagnosed with PTSD, defined by the DSM-5, enrolled in VA health services, and also that they can adequately care for a dog, and the home environment is accessible to study staff and is suitable for a dog. So basically, service dogs were trained to provide specific behavioral tasks such as licking, nudging to help the veteran remain focused on immediate surroundings when faced with vivid memories or flashbacks, and helping to prevent these panic responses or manage crowded situations that may have particular value for veterans less comfortable with conventional mental health treatment. There are numerous limitations, but study findings combined with results from 2 other recent published controlled investigations provide evidence supporting the endorsement and use of service dogs as a helpful tool or alternative treatment options for some veterans. So therefore, social work practitioners may want to consider referring their veteran clients with PTSD to qualified service dog programs for adjunctive support when they have difficulty engaging with or benefiting from office-based traditional therapy approaches. And these are my references. Thank you for joining.